Hi there, Mom and Dad. Yung anak niyo ba ay nagsusuka or nagtatae? And worried ka sa dehydration? Yes, of course, we should be worried about dehydration. We will discuss this important topic in today's Ask Me Anything episode, where I answer your top 10 most common questions on dehydration in children. So let's get started. First question. What are the common causes of dehydration in children? So ano po ba ang causes ng dehydration in children? Kids can have dehydration if they have the diarrhea o nagtatae, suka ng suka or vomiting. Prone din ma-dehydrate ang batang may fever or lagnat. And if your child is not taking sufficient fluids, like heat and excessive sweating from physical activity, can also lead to dehydration. Number 2 question. What are the signs and symptoms of dehydration in children? Well, signs and symptoms of dehydration include if your child has dry mouth and tongue, there is lack of tears when crying, when you notice sunken eyes and cheeks, so parang lubog yung mata. There is a sunken soft spot on top of the head of infants. An important sign is decreased urine output. So, konti na lang ang ihi or dry ang diaper ng baby. If your child is irritable, can also be a sign of dehydration or lethargy o matamlay yung bata. Severe dehydration can in turn lead to rapid heart rate or mabilis ang heart rate, and also rapid breathing o hingal yung bata, and cold mottled extremities. So pag hinawakan, malamig yung bata. These can be signs of severe dehydration. Number 3. So how can I prevent dehydration in my child? Please make sure that your child is taking plenty of fluids, especially during hot weather or during illness, like when your child is sick with a fever. Also, water is the best choice, but it is also important that you give your child oral rehydration solution or ORS when your child is already dehydrated. Please avoid sugary drinks and caffeinated drinks, which may worsen dehydration. Number 4. When should I seek medical attention for my child's dehydration? Well, it is important that you seek help and bring your child to the pediatrician if your child is already showing signs of moderate or severe dehydration, such as an important sign is lack of urination for more than 6 to 8 hours. So if your child hasn't had a wet diaper for more than 6 hours, you need to be worried. If your child is extremely thirsty with a very dry mouth, if your child has sunken eyes o lubog ang mata, and if your child is lethargic or matamlay na. Also, if your child is vomiting persistently and is unable to keep any liquids down, so suka siya ng suka and you try to give water or ORS pero sinusuka niya pa rin, then you should worry about dehydration. Or if the diarrhea has been lasting for more than a few days and your child is exhibiting signs of dehydration. These are signs that means you need to bring your child to the pediatrician. All right, what is the best way to treat mild dehydration at home? That is true. You can treat your child's mild dehydration at home by increasing fluid intake with water. An important drink that you need to give your child is the ORS or oral rehydration solution. Encourage your child to drink small amounts, so pakonti-konti, but do it frequently o dalasan yung pag-inom ng pakonti-konti, which is more effective rather than giving your child a large amount which he or she may vomit. And of course, for breastfed infants, to continue on breastfeeding. Number 6. Are there any special considerations for infants regarding dehydration? Alright, Infants are more prone to be dehydrated. Why? Because they have high body water content, and so they can become dehydrated quickly. It is important that you monitor their hydration status, especially when they're sick with a fever. Signs like dry diaper for more than 3 hours, sunken soft spot in babies, and sunken eyes. That means your child may have moderate dehydration already, and you need to bring your child to the pediatrician. Number 7. Can dehydration affect my child's overall health long term? Well, if the dehydration is severe, it may lead to complications such as kidney failure. Other complications that may arise can be kidney stones, urinary tract infections as well. But with proper treatment, no need to worry, your child can recover fully. Number 8. What types of fluids are recommended to rehydrate my child? Well, the American Academy of Pediatrics recommends an oral rehydration solution, which is the best form to rehydrate your child, and also for breastfed babies to continue on breastfeeding. Please avoid sugary beverages, caffeinated drinks, and full-strength fruit juices because they might worsen dehydration. Number 9. How much fluid should my child drink to stay hydrated? Well, the fluid needs of a child would depend on their age, on their weight, and their activity level. A general gauge would be your child should drink enough fluids to prevent thirst. So during hot weather or during an illness, your child needs to drink more fluids than usual. You encourage your child to drink pakonti-konti or small amounts, but do it frequently. Number 10. Can certain foods help with dehydration? Yeah, foods with high water content like fruits like watermelon or oranges, and also vegetables with high water content such as cucumber and celery can help maintain hydration. These are helpful if your child is reluctant to drink fluids. Hey, if you like this video, watch my next video where I teach you about other child health problems.